When Sameer's case of stomach tumor worsened, his family brought him to Delhi for surgery all the way from Hisar. Sameer had a health insurance cover of 5 lakh rupees. The treatment cost of 4 lakh rupees was computed, but the insurance company deducted 20% from the total claim amount. Sameer had to pay around 80,000 rupees from his pocket. Let's see why this happened with Sameer. The reason why Sameer did not get the full claim amount is not because the insurance company did not pay, but a rule of health insurance policies that people often overlook. The cost of insurance premium is determined based on several factors, such as the age of the policyholder, medical history, occupation, and even the city they reside in. Health insurance companies have divided the premium into 3 categories based on the zones of the cities. These are Zone A, Zone B, and Zone C. The metro cities of the country come under Zone A. Cities like Bengaluru, Ahmedabad, Surat, and Jaipur are included in Zone B, and the rest of the areas fall under Zone C. The important thing here is that all insurance companies have categorized zones according to their own criteria. Therefore, the category of zone will vary in each company's plan. People living in villages or small towns get cheaper health insurance compared to big cities. But when they use this policy in big cities, the company deducts the claim amount based on the policy's terms and conditions in that zone. For example, Sameer is 30 years old. He has a wife and 2 children. If he takes a Bajaj Allianz Health Guard Family Floater plan of 5 lakh rupees in Delhi, that is in Zone A, then he will have to pay a premium of 20,945 rupees. In Zone B, he will have to pay 16,756 rupees for the same, while in Zone C, he will have to pay 14,662 rupees for a cover of 5 lakh rupees. This way, Sameer will get a 20% cheaper insurance plan in Zone B and 30% cheaper in Zone C. Talking about Bajaj Allianz, if a policyholder living in Zone C gets treatment at a hospital in Zone A, then he will have to personally bear 20% of the bill. Similarly, if a policyholder from Zone B gets treated in Zone A, he will have to pay 15% of the expenses from his pocket. If someone from Zone C gets treatment in Zone B, he will get a 5% lower claim. The same thing happened with Sameer. He had taken insurance coverage based on the premiums calculated as per terms and conditions applied on policies in Zone C, but he got treatment in Zone A. Therefore, he did not receive the full claim. If you live in Zone C, choosing the premium option of Zone A can help you avoid problems like Sameer's. If you live in a small city, you have 2 options for health plans. You can opt for a plan with a lower premium under zone-wise slab, or you can opt for a regular health plan by paying a higher premium. Many times, people without understanding the co-payment rule buy insurance policies. Later, if the need arises for treatment in a big city, they feel cheated like Sameer because of the co-payment issue. Midas FinServ director Pankaj Rastogi says that the cost of hospitalization in small towns is lower compared to metropolitan cities. Insurance companies also acknowledge that people living in metropolitan areas may face a higher risk of lifestyle-related illnesses. Therefore, the premium for Zone A is higher. Some insurance companies try to provide the people in villages and small towns with the benefit of lower cost. But you should overlook the benefit of saving 2,000 to 4,000 rupees premium. If you have to undergo treatment in a big city in the future, you might end up paying several times the saved amount in one go. To avoid situations like Sameer's, it is advisable to pay slightly higher premiums and opt for complete cashless coverage anywhere in the country. If you are shifting from one zone to another, inform your insurance company, so that next time during policy renewal, the premium can be adjusted and you don't face problems like Sameer. So the next time during policy renewal, the premium can be adjusted and you don't face problems like Sameer when you file your claim. There is no wisdom in saving 2,000 to 4,000 rupees on health security issues.